Welcome in. I'm Colette Wieland alongside Dr. Stephen Camerata. Steve is the author of Late Talking Children, A Symptom or a Stage. It's a book that's now in its second edition. Lots of great information. Some of it we're going to talk about today has to do with getting a proper diagnosis for your late talking child. First and foremost, why is that like the most important thing you can start to do?
So the reason it's the most important thing is because any support services or any treatment intervention, classroom placement, all comes out of that. And so it has to be accurate. And it's a real problem because the way that many systems work is they're simply trying to see if the child is eligible for services. And so the idea is, okay, I have a late talker, I'm not really worried about whether it's a symptom or a stage. It's, can I get them in a special classroom? Can I get them in a special program? And so they're not really thinking about, is it a stage or a symptom? And if it is a symptom, is it autism? Is it intellectual disability? Is it language disorder? Is it something else? So they're just going to do a very short, not in-depth kind of an evaluation just to see if the child can get into services. But those services will not match the child's needs unless that diagnosis is accurate. It's one of the most important things that parents need to pay attention to.
And once you get one diagnosis, should you seek to get more or a second opinion, just like you would maybe if someone said you've got a growth on your hand, let's, how to treat it, right? So how many opinions should you get?
So I think it's important to always, particularly if it's a diagnosis that's pretty severe and requires a lot of services and special placements, I think it's very important to get a second opinion. On the other hand, if the parents have a good understanding of the child, and most parents do, and the assessment that they get and the diagnosis they get fits in with their understanding, I think it's fine to just have the one. But if it's something like autism, I would absolutely get a second opinion on that, definitely. Or if it's intellectually disabled. I've had a number of cases where there's an initial diagnosis of intellectual disability, mental retardation, and then the child is recommended for a classroom that's for children who learn more slowly, need a lot of support, and pretty quickly it's clear that was a misunderstanding. You can imagine that's not only in the moment, but that actually has long-term implications for the child. And so you want to make sure that's accurate. It's crucial.
Do parents ever question you and the diagnosis you've given their child?
The parents do, and I totally welcome it. So one of the most important things is when you're interacting with somebody who's making an assessment or making a diagnosis is for that person to ask you, is this what you're seeing? Because parents have a lot of wisdom and knowledge that the clinician should be engaging with. And then if a parent disagrees with me, I'm going to say, well, tell me what you're thinking. Tell me why you disagree. I'm going to want them to question me, and I want to explain to them why I'm saying what I'm saying. So, for example, there are times when I will diagnose autism, and the parent will say, well, I don't agree with you. And I'm saying, you know what? I'm happy to hear about that. I don't feel like you're in denial. I think these are reasonable questions. And I'll say to them, here's why I think your child has autism. Here's what I'm seeing. I understand that you don't agree, and for now, I'll even say something like, "Well, this is my diagnosis, and I'm going to do a report and put that in there. It's your report. You use it however you want. And what we agree on is your child's late talking. So let's teach your child how to talk. We know how to do that. And then, if the child does have autism, there'll be other things besides the talking that we have to deal with: the low motivation for social communication, the reliance on routines, some of the compulsions that we see in autism. Those will persist. So." It's really important that parents feel like they can ask questions, and they should not feel like they're being pressured into accepting any diagnosis. If they don't agree with it, the clinician should form consensus with them as to what next steps are, and they shouldn't necessarily feel bullied into taking a label they don't agree with. That's also very foundational.
So tell me what that, as a provider, as someone who's providing that diagnosis, how's that make you feel when parents do question your ability or have additional?
Oh, yeah. Again, I really welcome that. I mean, okay. I got to tell you, and this is, when I'm working with a family where the child has autism or intellectual disability, some of these conditions, some of these symptoms that are long-lasting, I know from experience what the journey is going to be. And in some cases, for example, where there's kind of classic severe autism, that family's journey is going to be really challenging in many ways. There's a lot of joy. there's a lot of wonderful things that are going to happen on that journey, but the journey itself is much different from other families and much more difficult in some ways. And so I can, in a way, it's hard for me. I don't really want to tell parents that. I can imagine a physician, with a pretty severe cancer diagnosis having to communicate that to their patient. And this isn't like that, obviously. That's more life and death. But there's a parallel in that I really understand how difficult that's going to be. And I really want the parents to question me. I welcome parents questioning me. I want them to ask questions. I want to take the time to answer all the questions they have and really do my very best to support parents on their journey. And especially in these situations where it's a difficult, challenging educational condition or learning condition that we're seeing.
So once a child has a diagnosis, the next step would to be starting some sort of treatment, whatever that looks like, right? But how can the wrong treatment interfere with a child's natural development?
Yeah, so the example I like to use, again, kind of pivoting off the cancer situation. So let's say that you have a little spot on your skin and somebody says, well, you're on the cancer spectrum, so I'm going to give you radiation and chemotherapy. But maybe it's not really that kind of cancer that requires that. So we only want to use the more involved, the more drastic treatments for when the child really needs them. And so one of the things that I worry about a lot is that if you have an incorrect diagnosis, you're going to be in the wrong classroom with the wrong support services. You're also going to have people around you treating you differently based on the diagnosis or based on the eligibility. And so it's really important that that be accurate. If somebody has low expectations for how someone's going to learn, that can become a self-fulfilling prophecy. We know that, for example, if you take a child who doesn't have an intellectual disability and you put them in a classroom for intellectual disabilities, their opportunities for learning are going to be much less. And we know from lots of studies of what's called inclusion that the outcomes just aren't as good. And so it's really important that you have the right placement. You should be in the right place for the supports you need, and that you're getting the right kind of educational treatment. So the assessment is important and the diagnosis is important, but that's really just the first step then on what do I do now? How do I support my child's learning within their unique learning features? And that, for children that have more severe challenges, it's even more important that be done absolutely correctly. Because any incorrect types of supports is going to waste their valuable learning time and really adversely affect their outcomes.
In the book, you urge parents to find out if treatment for their late talking child includes use of a restraint. I hadn't heard of that before. But why is that something that would even be considered for a late talker?
Yeah, so there's a belief, a mistaken belief, and actually not only in my opinion, but actually the data show this, that a late talking child who has autism or otherwise needs motivation, that you actually have to restrain them and force them to talk. And it's inhumane. I will strongly assert that it violates human rights and basic human rights principles. But the belief among the clinicians is so strong that they'll actually strap a child into a chair and restrain them and then force them to imitate or respond to prompting. And that's child abuse. To be sure, if somebody has a orthopedic condition where they need to be supported, like some of the work I do is with several people with cerebral palsy, and they have to be in wheelchairs, and if they're not strapped into their wheelchair, they might fall out. And that's different. I'm not talking about that. I'm talking about where you're restraining the person so you can force them to comply with whatever treatment that you're trying to get them. And the only time that you should use restraint is when it's absolutely medically indicated. The example I like to use is my oldest, he got hit in the head with a swing when he was little, and they needed to put him on a board and basically tie his head down so he wouldn't move so they could stitch up where the swing had hit his eye. So the restraint's fine for that, because if he moves, right? And so, but that's it. I mean, you should never restrain a child to force them to talk. That's just out of bounds. And it happens all too often.
Why?
It's really interesting. I was talking to a clinician one time who did that, and I was trying to persuade her that it wasn't good. And I'll just tell you, that I'm sorry I'm being modest. I have published over 130 studies. I've never tied a chair down, and we have some of the most effective treatments in the literature in terms of like effect sizes and how effective it is. I've never tied a child down, ever. And so obviously you don't need to help them how to talk. Anyway, I asked her, I said, why are you doing this? She said, well, I can just put them where I want them and I can get them to do what I want. And it's just too much trouble to follow them around. And, it was almost like a convenience answer. And I don't think I ever persuaded her she shouldn't be doing that. Yeah. And it's just, and then other people just have a strong belief. Like I have one colleague that works with speech sounds, and she's convinced that she has to put her hands in the child's mouth and move their tongue into the right places to make speech sounds. And again, I can show you with lots of data that you don't have to do that, but if you stick your hands in a kid's mouth, you can get them to make an S sound or whatever it is. It's just when they're talking spontaneously, no one has their hands in their mouth, so it's not good. And, I told her one time she was going to do it. I said, that kid's going to bite your fingers off. Don't put your hands in that kid's mouth. Bad idea, But anyway, there's people just have strong belief systems, and there's certainly this strong belief system that you have to force the child to talk, and it kind of comes out of that. There's been so many also violations of human rights. So some of our children with challenges, they'll put them in like what's called a timeout room. Don't do that. They'll leave them in that timeout room, and then sometimes they're neglecting. One case I was involved in, the teacher held the child down, and the child was just screaming, and they were just holding him on the floor, and things like that. They're just beyond the bounds of dignity and human rights. So we always want to have that as our basic relationship. Even with children with severe challenges, we want to make sure we're seeing them as human beings and having the right to certain, basic humane treatment. And certainly that's true for late talkers, especially those that can't really tell you what's going on and why they're upset.
Yeah, that's why they're there, because they aren't able to clearly communicate yet.
No, that's right. And that's why that detective work is important, to try to understand what it is. One of my colleagues did a study in a severe classroom, and he measured when the children were acting out, and he showed that it was actually they were communicating that they were in pain. So they had some internal pain, a stomach ache or something like that. And the teachers and other people didn't understand. The teachers are wonderful, and they're really good, and they're in tune with their kids. But it was just these internal states, and the child couldn't say, "Oh, gosh, my stomach aches. That's why I'm out of sorts." They aren't able to say that, but the way they communicated is maybe by hitting themselves or being disruptive. So
I remember that when I had a toddler, and they were saying, keep an eye out if she starts batting her ear, because it might be
That's
earache,
a great example. Very good example, right? It may be a sign, or they tug their ear. Might be a sign, oh, my ear's hurting, because they're not at that point able to even communicate. Oh, I have an ear infection. Can you give me some painkiller?
I need some antibiotics.
Right, exactly.
ASAP.
Right.
Well, all late talking children should have their speaking and listening ability evaluated by a speech language pathologist. So how do parents make sure that's being done? How do they do that?
It's one of the most amazing things to me that, the child's late talking. That's what gets them into the system. And so because they're late talking, you can kind of think of it almost like a medical panel. So when you go to the physician, they're going to do blood pressure, going to take your temperature, listen to your heart, and so on. These are things every patient gets. A late talker should always have an evaluation of their ability to pronounce sounds, their speech. They should always have an evaluation of what they understand, and they should always have an evaluation of their ability to use words and put words together in sentences and so on. It's like our basic panel for a late talker. And so a speech pathologist is trained to do that. And so it's important to do that. Some other professionals might know about that, but it's really something a speech pathologist does. So if the child's late talking and that's why you're there, then you want to insist you get that. Another thing I just want to comment briefly on is that we want to use the diagnoses that are kind of widely accepted. So there's also pseudoscientific or questionable diagnoses that don't have a lot of evidence behind them, and they may have been made up by a person who has a belief system, or they're seeing the world through a certain lens. So, for example, there's this condition, it's controversial, it's called central auditory processing. And so that's not really, so central auditory processing basically says that the reason the child's late talking is because they hear the words scrambled up. It's kind of like what happens in stroke patients. Like we have a thing called Wernicke's aphasia, and they really do scramble up the words when it comes in. But late talking children, it's not really a real diagnosis. And mainly these kind of controversial diagnoses are used as a way to market treatment. So the people who do central auditory processing, they might market some of these non-evidence-based types of treatments for, like, on a computer. They might have them on headphones or things like that. One of the treatments is to take the speech and slow it down really slow and have them listen to that. And those things just aren't really effective. So the treatment can be based on a controversial or non-evidence-based diagnosis. Another one we hear a lot is sensory integration deficit. And I want to say this about, I've actually written a pretty big paper on it. Children, many late talking children do have differences. They may be more sensitive to sound or less sensitive to sound, more sensitive to touch, less sensitive. That part's true. But the sensory integration deficit diagnosis that a lot of kids get, it's not a standard diagnosis. And it doesn't really explain why they're late talking. There's a lot of belief around that. Having said that, when people give sensory integration treatment, they're usually play-based, they're around equipment, and so there's a lot of positive things happening there. But the idea that you can brush a child's arm, so one of the things they do is they brush arms with soft brush to desensitize them to the tactile oversensitivity that's part of this kind of questionable diagnosis, and that's not going to help them talk better, So someone might say, oh, your child's not talking, they have sensory integration deficit, I want you to wear a weighted vest, I want you to let me brush them, and then I'm going to give you these brushes that cost a lot of money, and then I want you to do this at home. That's not really a good label or a good diagnosis or a good treatment plan. You want to work on the talking. So the diagnosis should involve something about talking. It should be a standard diagnosis. The main ones are basically non-clinical late talking, or where it's a stage, language disorder, speech disorder, autism, intellectual disability are the main ones that you would use. So if you get something different than that, you really want to ask what that's about and what they're thinking about. And always ask, if you get a diagnosis you don't really understand, ask for a detailed explanation, and then try and again get a second opinion.
I know this might be difficult, but if we were to say, okay, here's the 5 things you need to do. Maybe it's 3. I don't know. You tell me, what are the 5 very first things that a parent of a late talking child needs to do, right? You said get evaluated.
Oh, right. So the most important thing initially is to get an evaluation by a pediatrician or family physician to rule out any medical conditions. Most of the time, there's not a medical condition. You want to have their hearing tested. Usually an audiologist does that.
So evaluation, hearing test.
Yeah, medical evaluation, hearing test. And then once you've kind of ruled out general health conditions and hearing loss, then you want to have a test of how much they understand. And you want to have an evaluation of if they're having trouble pronouncing words, if that's what's holding things up. And then you also, if they are using words, you want to understand, what kind of vocabulary they're using and more about their actual language production.
And then you'll kind of go on different paths.
Right. Well, once you know that, then you can say, oh, in addition to that, is there something like, gee, they really don't want to communicate. They're not really socially attached in what we see in autism, or they're relying on routines to this really unusual extent. Again, the key here is that like all toddlers do routines,
Right.
So it has to be over and above what you would normally expect. And then, you'd be looking for other kinds of things that go on top of that. So basically they're late talking, so you want to evaluate the talking, and then you're going to add things. And in your diagnosis and your thinking, you're actually ruling out these other conditions that may actually be contributory as well. And then you want to stick to these traditional diagnoses that are focused on talking. You really don't want something that's kind of this pseudoscience type of diagnosis that doesn't necessarily fit. Like there was one I remember recently where they basically said that the bundle of fibers that connect the sides of the brain, the corpus callosum, which I actually didn't talk like this, and I'm like, what? And that the 2 sides of the brain didn't coordinate better, and so they were going to rub a electrical stimulator over their skull to get the brain to synchronize in some way. Yeah, and I'm like, I need to really evaluate the evidence on that one. It just doesn't ring true. To be fair, well, actually, I do know a bit about that and haven't seen any evidence for it. But to be fair, I have to get into that more. But something like that, you're just going, no, that's not really directly associated with talking.
Well, listen, most parents aren't medical experts, right? So even some of the words that you're throwing out there, I have to sit and go, okay, does that make sense? So I imagine there's a lot of parents when they start talking to a medical professional get very confused. So what questions do they need to ask? How can they work with their provider to simplify it and break it down?
So that's a fantastic question. And so I think the main thing really is to say, what is your diagnosis? Why do you have that diagnosis? And if they tell you something you don't agree with, just say, you know what, that's not really my experience. Tell me more about why you think that. And the other thing too is to ask them what they're recommending, because in the end, whatever label you have, what really matters even more is the placement and the treatment. So where are you sending me to get support, and what kind of support are you recommending? And once you know that, you'll have a better sense. So if somebody says, oh, your child has, sensory integration deficit, and I want you to go and I want you to put a weighted vest on, I want you to rub their arm with a brush, you're going to go, even, someone who's not into the weeds on that, you're going to go, how's that going to help my child learn to talk? So it really should be pretty much focused on what you're seeing in your child, and there should be a common sense to it. And the professional should be able to, you might use technical language, but then they should be able to kind of meet you where you are and tell you and explain to you in simple words what they're seeing and why. And you have every right to expect that as a parent. I mean, there's a big commitment to helping your child, so you want to make sure you're on the right path.
You mentioned in the book, Chapter 6, that all parents should ask point blank before a child is tested whether the clinician is only looking for autism to determine whether a child is eligible for services or is completing a differential diagnosis and looking for something besides autism. And I wanted to make sure I read that correctly because I think it's really important. So please expand on that and help parents understand why.
So in our current kind of service delivery in the United States and also in some other countries as well, basically the reason the child initially gets in to be seen is because they're late talking. So you go to a pediatrician, 18 months of age, pediatrician says, hey, is your child using words? Parent says no. Then they're going to be put into an assessment system. And basically that assessment system in some cases is designed to give them an autism eligibility label and then put them into an autism intervention that may be 10, 20, 30 hours a week that's based on ABA, which is a prompt-based, force-based program that we should be using only rarely for the kids that actually need that. And so there's a whole system, and I don't mean to be critical. This isn't like some conspiracy theory. It's just how service delivery works. And because that service is reimbursed, people are going to be pushing them into that. So the question you ask, so if you ask me and you say, okay, you get 100 late talkers who come in your office, you want to ask them, how many walk away with an autism diagnosis? How many do you say, I'm going to monitor them, I'm going to do some parent enrichment? Probably a stage. How many of them are going to say, oh, it's a speech disorder? How many of them are going to say it's a language disorder? How many are going to say it's intellectual disabilities? And those should be certain percentages. It shouldn't be, oh, every child that comes in here gets X label. Every child that walks in here, for example, gets autism. That's a problem. They're not doing a differential diagnosis. They're basically saying, okay, I'm going to see if they have some traits that feed you into this particular intervention path, which may not be a good match for your child.
So parents, make sure you ask that question, right?
Ask them how many children that come in here walk away with an autism diagnosis or autism eligibility, and what is it that you're looking for? What are the different conditions you're testing for? That's crucial. That you always want to ask that question before you even set foot in there.
I know we've talked about questioning the authority, if you will.
Right.
I know this could be sensitive, right? But is there some sort of level of denial that you see from parents, just not wanting to accept it, or they just truly feel though you don't know what you're talking about?
Yeah. So it's normal. So what happens in late talking when it's a symptom? Initially, the parents are really hopeful it's just a stage and it's going to go away. Then over time, it kind of unfolds and they realize, oh, this is something that's taking longer than we would expect. And so it kind of unfolds over time. And so you're always you have this worry, and that's very normal. And parents also are just really, I love it that they see the good things their children can do. They come to me and say, hey, my child knows their letters, or hey, my child knows their numbers. I'm like, that's great. I love to hear that. On the other hand, it may be that they know their letters and numbers, but there's other like basic things that they don't know, that even like play skills and things like that. And so it's really clear there's something else going on, but that's hard. That's an unfolding thing. And so I want to be empathetic with that. And so when a parent is, like worried and they're not necessarily on board with, gee, your child has an intellectual disability, or gee, your child really has autism, I want to be accepting of that and patient and work with them when they are. So they are in denial in the sense that they don't agree with what I'm seeing. And that's really kind of a process that the parents go through, where they're watching their child develop, and over time they're realizing that this is something that's very different. And I want to be to be respectful of that. I don't want to ram anything down a parent's throat. I want to build consensus. I want to help them on their journey. I don't want to just say, hey, look, you're in denial. You need to deal with this, buck up or whatever it is. You're just never going to hear me say that. And again, I absolutely welcome people questioning my authority and my knowledge. I should be able to tell them exactly what I'm seeing and why, and be able to back up what I'm saying with observations. And if a parent says, gee, I don't see it the same way, I'm gonna say, okay, that's fine, And by the way, I'm not perfect, I'm
Sure.
mostly right, but not always right. So, I also want to say, hey, I could be wrong, and let's celebrate it if I am.
Well, one thing I think is a really neat perspective is that not only you yourself were a late talker, even though that was so long ago that you don't remember it, right? That you had to be told.
I don't remember it. Yeah.
But you experienced it as a parent. You and Mary raised a late talking child. So you've gone through all of the process that these families are going through. And I know you've encountered some absolutely wonderful educators, but at times you've talked about being met with some resistance, right? And that's the challenge, because if everybody was wonderful, you wouldn't have that need to like step into some school districts, right? So I want to talk about your experience, so some of the challenges that you yourself went through that some of these parents are going through right now.
Yeah, so the first thing I want to say is that with just very few exceptions, and I've encountered thousands of teachers, they want to teach, and they're good at it, and they're dedicated. And what I really would say is that some of them kind of only have one way to teach, or a kind of a limited toolkit. And so it may be that your late talker doesn't necessarily match up with that. The other part of it is that when the child doesn't learn, if they don't necessarily understand the learning differences in late talkers, they may attribute it to something else. So as an example, when my late talking son was in second grade, we had an educational meeting, and the teacher said, I think your child has attention deficit hyperactivity disorder, ADHD, and that I really think you should get a medication. And so I'm like, okay, well, let's hear about that. So, she was telling me why. One of the things she said is we don't discipline them enough, which I found a little humorous. And, it's like, well, you don't really know what discipline we use, But beyond that, I came back at her and I said, okay, now tell me when you think he's not paying attention. She said, oh, when I read stories, and they didn't really do circle time, but she would read stories. She said, he doesn't pay attention. And in fact, he'll get up out of his desk and he'll move around. And I said, okay, now I want you to think about other times when he doesn't do that. And to her credit, and she's a good teacher, she was like, well, when he's doing math problems or when he's drawing, he loves to draw, he sits still for a long time. And I said, okay, so let's think about that. So it could be that he has attention deficit and needs medication. It could also be that when you're talking to him in complex language, it's kind of like you're talking to him in a foreign language and he's not paying attention. And that helped her to understand. But that's the kind of thing that you're going to encounter. And then fast forward to high school, his history teacher's just a good friend of mine. And one time he came up to me and he said, I just think, he's not really trying, in history class. And, well, I don't really understand that, tell me why. Because he actually was somebody who really did make a good effort. He said, well, on the quizzes, he just does terrible. And then on the exams, he does really well, And so I said, okay, well, it could be that he's not making his best effort, but tell me more about the quizzes. And they said, well, the quizzes are based on the in-class lectures. The exams are based on the reading. And by that time, he was a good reader. Remember, poli-sci major. Sure. And so he was thinking, well, he's not doing well in the quizzes because he's not trying. He was mapping it onto effort. And by the way, this is an awesome teacher. I mean, I just have a world of respect for him. But he was thinking, okay, the child's not learning. I know he's smart. I know he can learn. And so he was describing something else to it. And was really, and then I talked to him. I said, well, when he reads something, it's visual, and he can now read good with comprehension. He'll remember it. If you talk about it, it comes in and it's gone. He can't do that. So it's really important to help the teachers understand the learning differences in the late talker. And then, frankly, there's just some teachers that, they're not that common, thankfully, but they're just my way or the highway. And they're really stubborn, and in a way, maybe they were late talkers and they're stubborn themselves. But anyway, the bottom line is they just may not adjust at all. They have one size fits all. The late talker has to comply, and that's where we look for different placements and different teachers, because it's just not going to work. If the teacher can't adjust to meet the child where they are, then it's probably some like there was a young man who was really good in math, and the grade school just wouldn't accommodate his math needs. And so we tried, and they just wouldn't accommodate him. So we had to put him in a different school, in a different classroom. So that happens too. But thankfully, that's pretty rare.
What do you want to say to those parents right now? How to stand up for your child? Give them some words of encouragement, because I think that's one of the hardest things, right? We've been taught you don't make a ruckus, right?
Yeah,
but
I got to tell you,
need to.
Being a late talker, in some ways, it's easier for me to go into a situation where there's a lot of people kind of telling one thing, but for me to kind of question it. And so I have to think about other people in situations. So sometimes I go into like an education meeting or an assessment meeting, and there's like a team of people, a school psychologist, a special educator, and they're just pushing the parent, and it's hard to stand up for that. So I would say what I say to people is, I want you to imagine you're your child and you're taking that, and maybe that'll help you too, like defend it. And what I always say to people is, when those people are mad at me and they're questioning what I'm recommending, it's better they're doing that to me than it is to the late talking child, who really isn't in a position to communicate what they need. And so you need to be their voice, and hopefully that'll help you to be a good advocate for your late talker, because there are times when you have to stand up, so. But it's hard. It is hard, and oftentimes there's just a ton of pressure, and that can be difficult.
Yeah, and that applies to all things for
Yeah.
your child, right? I mean, Mama
Right.
bear, Papa bear, they're going to come out when needed, but
that's
it's
right,
intimidating when it's a medical professional you're relying on.
Absolutely, yeah. And so that is very difficult, and I'll just finish with, one of the places recommended for my son was in a classroom for intellectually disabled, mentally retarded, and so the psychologist pushed that. We had a lot. In fact, I don't know if Mary but mine, but she was in tears, and I was just like, no, you're wrong. And the reasons why I could say that was authority, but I'm so grateful that we could say that, because I really think that his whole life would have been different if we accepted that placement. This is in preschool. He's only 3 years old at the time. And I think that, thinking about that maybe will help parents to kind of stick to their guns when they need to.
One final note on this topic. Does a parent have to accept a label that is given to their child?
They don't. They really ultimately have authority, but I will tell you, a lot of times there's a lot of pressure. Someone might say, hey, if you accept this label, you get these services. We're educational professionals, or we're treatment professionals, and we know this, and there's going to just be a lot of pressure. But the parents ultimately have the final say. And again, they may not even be made aware of that, but it is true. It's one of their rights. In the U.S. anyway, it's one of their rights that they don't necessarily have to accept a label that's not accurate.
We're going to talk more about early childhood services in our next podcast, so please join us here. But in the meantime, we want to hear from you. Ask us a question in the comment section, and be sure to click that subscribe button, hit the bell. You can always check out the Late Talkers Foundation website in the meantime.
And always remember, the best thing for your child is you.